download our app available from the App Store and Play Store. Hello and welcome to Medical Dialogues. I'm Roshni Dhal. Let's look at today's daily bulletin. Despite the ongoing protest from the entire medical fraternity in the state, the highly debated Right to Health Bill got passed in the State Assembly today after the Health Minister of the state explained the features of the bill. While on the other hand, the private hospital doctors, resident doctors from medical colleges were protesting against the bill at the Statue Circle near the Assembly, the Rajasthan Legislative Assembly passed the bill by voice vote. Commenting on the matter, Health Minister Parsadi Lal Meena told media that Rajasthan is going to be a model state in the entire Asia for providing the residents of the state with the right to health care. It was the vision of the Chief Minister that people get the right to health care, and the bill got passed in the Assembly today. With an aim for better research and development of cancer diagnosis and treatment, the NMC has recently requested all the medical colleges and institutions providing cancer diagnosis and treatment to register themselves with the National Cancer Registry of ICMR. Writing to the deans and HODs of pathology department of all the medical colleges in this regard, K. Srinidhi, Under Secretary of NMC, mentioned in a recent letter that in order to meet the need for research and development for diagnosis, treatment, and effectively monitoring for control of cancer, all medical colleges and institutions providing cancer diagnosis and treatment are advised to register themselves with the National Cancer Registry. We're still dealing with the post-effects of COVID-19, and now a drug-resistant and potentially deadly fungus has been spreading rapidly through US healthcare facilities. The fungus, a type of yeast called Candida auris or C. auris, can cause severe illness in people with weakened immune systems. The number of people diagnosed with infections as well as the number of those who were found through screening to be carrying C. auris has been rising at an alarming rate since it was in the US, researchers from the Centers for Disease Control and Prevention reported on Monday. C. auris can spread from patient to patient in healthcare settings such as hospitals and nursing homes by direct contact. It might also be spread by contact with contaminated surfaces in the environment. Most common Candida auris symptoms include a high fever and chills that do not improve after antibiotic treatment for suspected bacterial infections, according to guidelines from the CDC. Additional symptoms can develop if the infection spreads. The study's lead author, Dr. Megan Lyman, Chief Medical Officer in the CDC's Mycotic Disease Branch, said that we have seen increases not just in areas of ongoing transmission but also in new areas. With an aim to address the shortage of doctors in government hospitals, the Punjab government plans to launch a new program called Earn While You Learn, which would recruit newly passed out MBBS students to the healthcare institutions of the state with a good salary. The Health and Family Welfare Minister Dr. Balbir Singh on 18th March announced that the AAP government would soon start a program in which MBBS pass-out students would be deputed into healthcare institutions with attractive salaries. The MBBS recruits would be given a salary of ₹70,000 and accommodation facilities by the government. He also said that the students would receive on-the-job training, both practical and theoretical, from the teachers of medical colleges in the online format.
TALAPRO-2, a study led by Neeraj Agarwal, demonstrated that using Talzenna in combination with Xtandi may reduce the risk of disease progression or death by 37%. According to the National Cancer Institute, prostate cancer is the most common cancer and second leading cause of cancer death among men in the US. Castration-resistant prostate cancer or CRPC is a late state of prostate cancer that continues to grow despite androgen blockade. TALAPRO-2 combines two oral medications, Talzenna and Xtandi, to treat metastatic prostate cancer. The trial looks at the effectiveness of adding Talzenna to the standard treatment of Xtandi, an androgen receptor blocker that prevents male hormones from feeding the cancer. Talzenna is a PARP inhibitor typically used to treat breast cancer. It has long been known that viral infections can be more severe in males than females, but the question as to why has remained a mystery until possibly now. The key may lie in an epigenetic regulator that boosts the activity of specialized antiviral immune cells known as natural killer or NK cells. In a study published in the peer-reviewed journal Nature Immunology, a collaborative team of UCLA researchers have found that female mouse and human NK cells have an extra copy of an X chromosome-linked gene called UTX. UTX acts as an epigenetic regulator to boost NK cell antiviral function while repressing NK cell numbers. About 17% of women with unexplained infertility also have gene variants known to cause disease, from common conditions like heart disease to rare problems like ALS, Medical College of Georgia researchers report. The researchers sequenced the exomes which contain the protein coding regions of genes of 197 females aged 18 to 40 with unexplained infertility, a percentage that comprises about 30% of infertile females, to look for variants in genes that were known or suspected to cause disease. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.